Welcome back, everybody. It's our final session of the day, and this will be our panel of some QHP executives from around the state. And before we get into that, I just want to introduce our guest moderator for this session, Justin Rivas. So Justin leads community health initiatives for the Milwaukee Healthcare Partnership, aiming to improve health outcomes and advance health equity through community-wide collaboration. In addition to overseeing community health needs assessment, planning, and Health Compass Milwaukee, Justin supports the partnership's Racial and Health Equity Council and serves as the program director for the Milwaukee Enrollment Network. Justin holds a Master of Public Health degree from the Zilber School of Public Health at the University of Wisconsin-Milwaukee, as well as a Master of International Public Affairs degree from the La Follette School of the University of Wisconsin-Madison. So thank you so much, Justin, for moderating this next session, and I'm looking forward to hearing from your speakers.
Great, and thank you, Allison. Good morning, everyone. As Allison named with a way too lengthy introduction, my name is Justin Rivas, and really happy to moderate our session, and really excited to bring our QHP panel leaders, executives, and representatives to this conversation with our statewide audience. I'm really excited about this virtual conference because I know it increases accessibility. So I hope we have all corners of the state of Wisconsin in the room this morning as we continue our conversation. I'm just going to double check that my slides are able to share because I'm going to switch to those at this point. All right. Excuse me. I think I picked up a good virus from the daycare that my daughters are at. So bear with me if I'm coughing a bit this morning. Hopefully you're seeing slides here for our QHP panel. And I'm just going to move through this title slide, but really I'm going to talk through some various aspects of kind of the dynamics of the enrollment environment generally in Wisconsin, and then get into some nuances of kind of plans and this year to come. Objectives for this next hour to have some shared insights and learnings from this diverse set of speakers on the panel, to kind of hear perspectives from those that offer Medicaid lines, as well as focused on marketplace product lines as well. To recap this last year, which has been an incredibly dynamic year. I don't need to tell you all that in terms of Medicaid unwinding and a really ramp up of marketplace plan selections. And then again, preview what's to come in this coming year. So this morning, who's going to be on our panel? We're going to have this great set of speakers to join me in just a bit. We're going to have Anthem represented by Doug Arnold, Course Community Health Plan by Christine Jacobs, Common Ground Healthcare Cooperative by Jennifer Wolkoyak, Group Health Cooperative Southwest with Martha Josephson, and Jonathan Moody from Quartz is here on the panel. They'll introduce themselves and their roles and their plans in a little more detail in just a bit. But I wanted to just highlight that I'm excited to have these great speakers here with us today. Okay, so I think the last session I jumped in on, and it was very much in the weeds in terms of talking about eligibility criteria, and we're going to zoom out in terms of talking about the kind of whole environment of what we see as the health insurance landscape, if you will, in Wisconsin after this dynamic year. So I'm going to do some data talking. Excuse me, I'm just going to get a little water. Some data talking at you for a bit, and please put those data caps on as we think about this. So what you're seeing here are two graphs. The first trend line, and we're talking about Medicaid enrollments here, is just the highest level Medicaid all programs enrollments, and this is pulled directly from the Department of Health Services public dashboard you can get online, seeing just what really happened in the last year in terms of Medicaid. And if we go back to March of 2020, you can see roughly 1.2 million folks were enrolled in some form of Medicaid program. That's statewide numbers. And a lot of the comparison that we've done in this work in the last year is kind of taking a pre-PHE baseline, we call it, or pre-public health emergency or pandemic, if you will, baseline. And that's an average of the 12 months leading up to the pandemic. So I bet that 1.2 million is probably even on the higher end. You can see this large increase in Medicaid enrollments through the pandemic to that kind of peak in April, May, June of 23. And then, of course, we've been unwinding for this past year to June 24 is the latest data we have. So by June of 2024, we have about 1.35 million folks on Medicaid, all programs. And just the point here is that really, compared to a year ago, we have a lot less people on Medicaid. But if we look back to that pre-PHE, if you will, we've kind of netted through the pandemic more folks enrolled in Medicaid programs. So just an important component to this conversation. And then on the second trend line, the red line, if you will, just really what supported or mitigated, I think, some of the challenges through this unwinding year is that the administrative renewal rate has really increased. And that has supported a lot of the work that you all have done and IM agencies in processing these applications. It went from 7.5% in September of 2023 all the way up to north of 40%, which again was a great win we had in Wisconsin. I'm going to shift really quickly in setting the landscape still with talking about now some data regarding marketplace enrollments. This is a super high level table showing the trajectory of the last decade of marketplace enrollments. All this is all statewide numbers. And the first bullet point is talking to really the great year we had in 2024 at a national level that trickled down to a state level and is also probably what you've seen locally in your communities in terms of marketplace enrollments. This last year, OE11, we hit our highest point yet of 266,327 marketplace selections. And that's over 20% increase year over year from last year. That's great work. Give yourselves all a pat on the back and really supportive of the kind of policy environment that encouraged this. You'll see the kind of shaded areas in this table just kind of let us know when there was positive growth in marketplace selections versus some of the negative growth we saw, or decrease, I should say. All good news as we come into our conversation this morning. I'm going to break down the marketplace at a state level just a little bit more, again, as level setting for our talk. So here you can see a statewide map, and this is comparing 23 to 24. And all counties are pretty much in a positive growth in terms of marketplace selections. The darker green would be the lowest percentage growth, moving through yellow, orange, and then red are the highest percentage growth. So if it's helpful to pick out your county, you can kind of see just relative to other counties, maybe how you performed locally. If you look at the two bar graphs on the right hand of your screen, the top one is showing the change by the Regional Enrollment Network, or again, like I said, I represent or lead the Milwaukee Enrollment Network, or MCEN, but you can look at the other regional enrollment networks and see that there's been at least 10 to 20% increase across all RENs, which is excellent work. And then it's interesting to look at the age group breakdowns too, really seeing on the bottom bar chart a growth in the younger age groups. So in the 18 to 25, really a high percentage of positive growth from 23 to 24. That's not to say that the 55 to 64 doesn't have a large number of folks picking up plans in that age group. They just didn't have the biggest growth. So that's actually the largest group in terms of those that picked up plans. A few more pie charts for folks, and then we'll get to the panel conversation. Here you can see just a breakdown, again, statewide, really high level of this last 2024 marketplace selection in terms of new consumers, automatic re-enrollees, and active re-enrollees. And here you can see that nearly a quarter are new consumers, which I think is exciting that we could all celebrate. Here the marketplace just breaking down a little bit based on FPL or federal poverty level in terms of picking up marketplace plans, and also age group. So on the first pie chart, you'll see that in the 101 to 138, which is our quote Medicaid expansion population, we had about 46,000 folks pick up plans. And I think that's important to see, just really the large amount of plans that were picked up really by folks that were in the lowest end of FPL groups, to understand that really important need is being served through these plan selections. The age group breakdown, again, I wanted to share just to contextualize when I said there was a lot of growth in the 18 to 25. It's good to see that, but that's still small relative to the 45 to 54 and 55 to 64 groups, understanding that those are the groups that are selecting plans most relative to others. And then lastly, my last data chart or data slide, I promise, is looking at both the metal tier level, again, statewide level, seeing that about half of the plans picked up were bronze level plans, about 40% were silver, and about 12% were gold. Of course, that varies quite a bit across the state. And then the second chart, I think it's interesting to look at rurality versus non-rurality to understand that nearly 100,000 marketplace selections were made by those living in rural parts of the state too. So there really is a geographic diversity to those folks that are taking advantage of the marketplace. So at this point, I wanted to get through that really quickly, and I think I did. I'm going to stop sharing screen, and we're going to move on to the panel discussion. And hopefully, I just want to confirm, Elena, we can see people's faces now, I think. Good. Or not just my face, at least. Alrighty, so at this point, I'm going to move to our first question, and I want to introduce the panel. So we'll just kind of go one at a time through our panel speakers. I would like them to introduce their name, their title, obviously their organization, and then just give them a few minutes at a high level, just discussing their kind of plan overview, if you will. So with that, I have Jonathan Moody from Quartz at first on my screen, so I'll hand it off to him for his introduction.
Hi, everybody. Well, thank you first to the Enrollment Network covering Wisconsin for hosting this panel and for inviting Quartz. Quartz, well, my name is Jonathan Moody. I'm the director of Quartz's ACA products. I'm also the director of our government affairs practice. Quartz is a community-based health plan. We are headquartered in Madison, Wisconsin, and have offices in La Crosse, Wisconsin as well. We are unique because we are an insurance company jointly owned by some of the best delivery systems in the state has to offer. UW Health here in Madison, Gunderson Health System based in the west part of the state, Unity Point, who you know from their affiliation with Meritor, and Advocate Aurora Healthcare based on the eastern portion of the state. We have about 333,000 members across our diverse portfolio of health insurance products. Of course, that includes our Medicaid, Medicare Plus, and Medicaid SSI products, as well as our individual ACA products. We offer, the majority of our membership is based here in Wisconsin, but we also do have plans in Illinois, in Minnesota, and Iowa as well. And that's my introduction. Justin, would you like us to run down the rest of question one, or do you want to start with introductions with everybody?
Yeah, let's just get through intros and get all the voices in the room here. So I got I have Doug Arnold next on my screen. Pass it off to you, Doug.
Yeah, can you hear me okay? Okay, perfect. Well, good morning, everyone. I'm glad to be part of this conversation, and much. I want to thank Justin and as well as the Milwaukee Enrollment Network, as well as covering Wisconsin, for allowing us to be a part of this panel conversation. My name is Doug Arnold. I am the Director of Sales for Anthem Blue Cross Blue Shield here in the Wisconsin marketplace. I oversee not only individual, but also small group ACA, as well as the large group 51 to 99 segment here. We are located here in Wisconsin, so right in Waukesha is our main location. And we have over 1 million members here in the state of Wisconsin, either through commercial, through our JAA business, our national accounts, or our individual business as well. So we're really proud to be part of the QHP panel today, be part of the individual offering that we have here in Wisconsin, and I look forward to the dialogue. And it's always good to see my friendly competitors on the camera. So thank you.
Thanks, Doug. I'll hand off to Jennifer at Common Ground next.
Good morning, everyone. I was so excited to see all of the new individuals that are attending this year's conference. It's always great to see the new attendees. My name is Jennifer Wakowiak. I oversee the business development area at Common Ground Healthcare Cooperative, which includes the sales area. We too are located here in Wisconsin. We are a nonprofit, been in it from the very beginning. We have approximately 55,000 ACA members. Our offices are located in Brookfield. We primarily focus on the eastern side of the state, and our healthcare providers that we have within our network are Aurora, Theta, Bellin, Children's, and then other independent hospitals throughout the eastern side of Wisconsin.
Thank you, Jennifer. I have Christine next. Hand it off.
Hopefully you can hear me. Sorry about that. Good morning, everyone. My name is Christine Jacobs. I'm the Manager of Sales and Business Development at Chorus Community Health Plans. We are also a local state of Wisconsin. Our offices are located in West Allis, Wisconsin. We are affiliated with Children's Wisconsin, and we serve roughly around 140,000 lives throughout the state of Wisconsin between all of our product lines. We Medicaid and a marketplace plan. Different plan options on the marketplace. Happy to be here, and I'm really thankful that you invited us. Thank you.
Thanks, Christine. And lastly, Martha. I think you're muted, Martha. Give it one more try. Still can't hear you. Not yet. We'll let Martha just, why don't you just take a second, try and figure out the tech there, and we will keep moving along. Maybe she can restart here. Oh, I love virtual connections, right? We've a couple of years into this, and I am often stifled by it as well. So we'll come right back to you, Martha. No worries on that. And I'm just going to pivot to actually our second question here is just kind of talking about 2025, so the year to come in terms of plan structure and member value adds. Are there any kind of high level plan structure changes, value adds, or benefits individually at your plans that you'd like to speak to, and just let the audience know here as kind of the statewide network of an enrollment assisters? Again, keeping this at a pretty high level, but just wanting to help folks plan and forecast for what they're going to see in 2025. I'm going to actually just go in reverse order and go back to Christine, if that works, if she wants to jump in on that and comment on that one.
Sure, absolutely. So for high level, we will continue to offer plans on the marketplace. We do know that there's going to be a few changes to that market as far as some changes to the number of plans that you can offer. So we will adjust our plan offerings and our portfolio based on that. Not too many changes, so there won't be too much consumer confusion or consumer disruption. So we don't expect to see that. We will continue to offer plans at every metal level. And we've also made some adjustments to the cost share for next year, they're all favorable adjustments, so I don't think members will be disappointed there. We'll continue to offer really a whole health approach to our health plan to make sure that we're walking really alongside our members in their entire health journey, offering different programs, case management wise, and other offerings that allow us to understand the needs of the members and allow them to participate in programs that really can help them manage their health in and out of the provider's office. So that's really kind of the position that we're going to take for 2025 and moving forward.
Great. Thanks, Christine. I just want to make sure, I think Martha, was she able to jump back on, or maybe she's signing out and relogging in? I don't see her on my preview screen. So Jennifer, I'm going to pivot to you on that one for Common Ground, and we'll go there. Yep.
As with the other carriers, no big changes. We are reducing the number of plans offered, as all carriers are required to do so. So every metal level, we will have 3 plan options, 1 standard plan, then 2 additional plans per metal level. We will continue to be in the bronze, silver, and gold, and also continue to offer a catastrophic plan. We are making some value add changes. We're in the process of affiliating with another company, which is going to bring some additional tools and resources to our members that our members have been asking for years. One vendor change, we are moving away from Virtual, which is a telehealth vendor, and moving to Teladoc. And that will also include behavioral health virtual visits. So we're really excited to be able to offer those to our members going forward. For the standpoint of our copays and out-of-pocket maximums, our members are going to see some decreases in the amount of the out-of-pocket maximums that they're going to be required to have for our plans. Our deductibles, some of them are reducing as well. So we're hopefully hearing the feedback from our members on trying to make the plans more affordable with less out-of-pocket expenses.
Thanks, Jennifer. I'm going to try and go back to Martha. Hopefully we got you some audio.
Can you hear me?
Oh yeah, loud and clear.
Okay.
Great.
Got a different headset, so I think we're good.
You're great.
Yeah, great. Thank you. Well, first of all, thanks for having me. Really do appreciate it. My name is Martha Josephson, and I am the product manager at Group Health Cooperative of South Central Wisconsin. Group Health Cooperative of South Central Wisconsin is a nonprofit member-owned health plan that provides healthcare to about 74,000 members in South Central Wisconsin. We offer individual and family plans on the exchange and off the exchange. We also offer plans in the small group, large group, and Medicaid market, and also offer a Medicare Select product. The majority of our membership is in Dane County, but we do also offer plans in Adams, Columbia, Grant, Greene, Iowa, Juneau, Lafayette, and Sauk County. We have an incredible member services team, and we really pride ourselves on being member-owned, quality-driven, equitable, inclusive, and also community involved. So thank you.
Excellent, Martha. And while we got your mic working so good, what do you want to respond to the 2025 question about just any forecasting or changes you foresee at a high level for your plan?
Sure. Yeah, we have had significant changes over the past couple of cycles. And so this year, we really wanted to minimize those changes. I think the biggest change is just the fact that, just like everyone, we had to decrease the number of IFP plans on the marketplace. But things like service area and benefits covered, we pretty much left alone. And like everyone else, just made our standard cost sharing changes in order to keep the plans in the correct metal tier for this year. So not a lot of changes. And as everyone knows, the maximum out of pocket went down overall that we could potentially have. So that's nice for our consumers.
Great. Thanks. Going to Doug next on this question.
Yeah, very similar to everybody on this call. Obviously, we all have the CMS guidelines. We also have the actuarial values that we have to be from a metal level perspective, right? But we're also sensitive to, I think, big changes that go on in the individual marketplace. So one of the things we're going to have minimal changes for 2024. There are going to be, I can tell you, we're going to have one less silver and one less bronze, but a lot of that has to do with getting into those metal levels from an actuarial value perspective. Much like everybody else, the CMS guidelines have impacted out-of-pocket maximum. So there are going to be plans with a reduction in that out-of-pocket maximum. But we are going to be introducing a new plan. It's called a Heart Healthy Plan. And that's really just, it quite honestly is for anyone, but it helps identify risk factors and help prevent heart disease amongst our members. So that's one of the offerings that we're having there. As far as like the service footprint and things like that, there's going to be some subtle changes there. But for the most part, the features and the plan designs are all the same. There's going to be a big push on Sydney Health. So for those that don't know, that's our member-centric app, which really allows people to engage their health plan a little bit differently. As simple as things of getting an ID card to checking up a provider, but also then just looking at like food insecurity in their area or maybe some income issues that they may be experiencing. Sydney Health can help bridge that gap for a lot of our members.
Excellent, Doug. Thanks. And to John
Yep.
on this one.
Oh, courts in 2025, like you've heard from the previous panelists, our intention is to minimize disruption to every extent possible. We will, despite with the plan limitations, reduce the total number of plan offerings, but we are committed to and will be offering plans across every metal level in every service area that we're in across the state. Maybe just as a primer and reminder for folks, we are in 45 counties in the state of Wisconsin. We cover kind of all portions of the state except for maybe the northern third, but we are in all of the regional enrollment networks. Our kind of core hubs are around our provider owner sponsors. So kind of Dane, La Crosse, and Milwaukee are kind of the core of our service areas. So in addition to offering plans across all metal levels, our philosophy was to, despite the minimizing of plans, is to continue to offer a range of standard and non-standard plans across multiple price points and benefit offerings to kind of meet people at the healthcare options and price points that they're looking for. So you can, that was the general approach of how we introduced our plans and responded to the plan consolidation from the CMS guidelines in the 25 NVPP. We do see some nice reductions in some of the cost share and out of pockets. And when there isn't a decrease, it's mostly stable. Courts introduced a new PBM in 2024. So not really a new change in our PBM process, but we're looking to create some innovations around our formulary and pharmacy benefits for 2025. I think that kind of summarizes it. We will, some of you may know, with the plan limitations, CMS did create an opportunity for some exceptions to that. One is for plans that allow dental and vision buy-up options, and courts has that in place. So just about all of our plan options, we have the medical benefit, and then we have an identical plan offering with a dental and vision buy-up. And those are offered through courts. So they're not only a nice additional benefit, but administered through courts rather than a separate standalone product with those benefit offerings. But we will not be offering, it will be very interesting to see, Doug mentioned the heart plan, whether there's additional kind of chronic condition plans that emerge in the market. That will be really interesting to see. And I think from a policy perspective, may see some of that across the country.
Yeah, that's exciting, John. And, from my community health and public health background, and whenever it involves social determinants of health, like we discussed food insecurity, I think that's really, really interesting, and things like housing. We're not going to go there, though. We're going to pivot to the next question around kind of this last year of dynamic environment, especially around Medicaid. So going to go back to folks, if you have a Medicaid line to speak to and how you kind of felt that or responded to that, and or just the Medicaid unwinding process, how it maybe was felt or impacted in kind of your plan selections. And I'll just go back to you, John, maybe if you want to answer that one and go back around the horn.
Sure, happy. So is the question about how we responded to the Medicaid unwinding?
That and if there's anything you want to speak to in terms of your Medicaid lines, if you have one.
Yeah, Courts has a Medicaid lines of business with Badger Care Plus and Medicaid SSI. We're in about 25 Medicaid counties, Badger Care Plus counties, which is kind of the lower portion of the state, excluding the eastern Lakeshore. So we do have Medicaid SSI in Milwaukee, but we do not have Badger Care Plus in Milwaukee. The other counties for SSI are Dane and La Crosse. And Medicaid unwinding was consequential for us, of course, like everybody. Justin, you showed those figures at the beginning with some of the enrollment patterns. We saw some of the, mirrored circumstances with our plan. We did see nice metrics in terms of the Medicaid members losing coverage, come back on to a Courts Medicaid Badger Care Plus plan after a gap in coverage. And we can talk maybe after everybody else kind of does their round robin, talk about what some of those tactics and strategies were for Medicaid unwinding outreach and engagement, and kind of education and health literacy. But that was really effective, not only in getting folks back re-enrolled and regaining eligibility to maintain their Badger Care Plus product, but also to enroll those that lost their coverage into our individual plans. We hit just about right in line with our forecasts of about 5%, a little bit over 5% of those members that lost coverage into our individual plans.
That's great. Go to Doug next on this one.
Yeah, so Justin, I would tell you for us, I don't oversee Medicaid, right? So I'm more on the commercial side. But I would tell you that there was a genuine partnership between us and our Medicaid team. For those that don't know, we have a Medicaid plan president, Ted Ostelder, and we work very closely with Ted and his team to make sure that we were connected in the appropriate way regarding the Medicaid membership that we have today, and making sure that we're capturing as much of that membership as we possibly can, either keeping them in a Medicaid plan or making an individual plan available to them. When we take a look at kind of the lengths that we went to as far as the unwinding, if you will, it really was across the board. So not only were we engaged as commercial and Medicaid teams here in the local plan level, but we were also engaging our provider community about what this would mean. And I'm going to say it's not perfect, right? There's still some confusion amongst members if they're supposed to be enrolled in Medicaid or individual. We continue to work through those kind of things. But we've also educated our brokers related to what is the unwinding and what does that potentially mean for them. So I think that was really important. We did a lot of updates through either our broker news blast, some of our websites like our Producer Toolbox or our Anthem Broker Hub. And then also just staying connected to Covering Wisconsin to see what we were seeing. It was always good to, when available, to participate in some of those meetings to see what kind of the grassroots initiatives are, what they were hearing in the marketplace, the communication related to it. So I think it's really, the approach was just staying highly engaged and just understanding what every area was doing to be able to make sure that people weren't falling through the cracks. Turn it over to you.
Yeah, thanks, Doug. Really great to hear there was that internal plan coordination on your end. And again, if you don't specifically have a Medicaid line, just kind of speaking to the unwinding impacts, if you will. Jennifer, off to you next.
Sure. So we do not have a Medicaid line. So I will just talk about the unwinding. One of the things that we found is that we had a lot of re-educating of our new members who were on a Medicaid plan. We didn't get a lot of the transition, obviously, since we do not have a Medicaid plan, but it was really from word of mouth of people who had an existing Common Ground plan sharing their experience with us, with their family and friends who then would select the plan with us. Our membership did not grow as greatly as probably some of the other carriers who do have that Medicaid plan that they were able to transition over.
Great. Martha, go to you next on this one. Oh, you're maybe muted, Martha.
Am I muted? Am I good?
Oh, you're it's so clear when you come through.
Okay, great. So, our strategy was also just to try to be as communicative as possible. We had multifaceted outreach for our members. We worked with our clinical partners to provide them with information just regarding on which members were up for renewal. We also reached out via mail and MyChart, which is the Epic HIPAA secure patient messaging on a monthly basis. We also supported that unwinding just by posting and spreading the DHS messaging on our social media channels as well. Our communications just included information on, how members could enroll in an ACA plan, and also provided that information about how they could receive enrollment assistance through Covering Wisconsin or through a GHC sales specialist. Although we did hope to retain them as a GHC member, we also always told them that they really should research what plan is the best fit for them, really what, fits their budget. We personally didn't see a ton of transition into our ACA block. Overall, we don't have a huge membership population. So we really kind of think that that's, more why. But during the federal public health emergency, we did see an increase from 5,300 to 8,700 members, which really increases, which is an increase of 65% in Medicaid enrollment during that PHE. So that was a lot. And then at the end of the PHE unwinding, we saw a decrease to about 6,900, and it's pretty much remained that for the last 5 months or so. And that just really equates to about a 21% reduction in Badger Care Plus enrollment since the PHE. If we were, looking at May of 2023 to July of 2024, we retained about 56% of those members that had coverage, from May 2023 to July 2024. But we continued to see growth. And so, from the start to the end, we still retained about 80% of our overall membership numbers there. We did kind of feel that this, exercise did kind of show us, though, that individuals do have coverage through other means like employer-based coverages. So we tried to stay as connected as possible. We felt that it went pretty well for us overall. So
That's good to hear. And your retention of coverage figures, because this is something we watched month over month through the whole unwinding in Milwaukee, was kind of right on par with that. It was about 56 towards 70%, depending on the month. So that was, similar to here. I'm going to go, I'm sure Christine has some comments on this one. So to her next. Or hopefully we didn't lose her. Actually, her camera's off. So I'm going to pause there then. Maybe she can get back on, or we can figure that out. But this is a good time to pause overall. We do have some polling questions to engage the audience. So maybe we can launch the first polling question. And I'm looking to Elena to do that, I believe. And I don't know if I'd be able to see.
Yep, it is. Yeah, Justin, Elena has posted it, and I can go ahead and read it. So it says, consumers with marketplace enrollments, where do you see the majority of consumers transitioning from? And so there's several options here. The first is uninsured or no prior coverage. The second is Medicaid, Badger Care Plus, or other state insurance. The third is employer-sponsored insurance. The fourth, another marketplace plan. And then finally, as a final option, other non-ACA plan like short-term medical insurance. So we'll give people another 10 seconds or so. We're getting some good responses already to this question, and then we can end the question and share out those results. So I'll go ahead and end it. And the most folks said 56% said Medicaid / Badger Care Plus or other state insurance. After that, we had 24% at uninsured or no prior coverage, and then 18% from ESI, employer-sponsored insurance, 2% another marketplace plan, and then 0% other non-ACA plan.
Thanks, Allison, for running that poll and talking through it. And yeah, it does sound like that majority is really the transition off Medicaid Badger Care Plus, which is what we'd probably expect with this question. But it's good to hear that from the audience. So in relation to our last little topic, and I see that Christine, I think, is back on, which is good. Christine, did you want to speak to Medicaid unwinding and kind of experience from your end and or your Medicaid lines?
Yes, thank you. Sorry, technology. Fun this morning. So CCHP does have a Medicaid product. We have an ACA product. So it was good to have some line of sight into who we thought was going to be transitioning off of our Medicaid plan. That kind of was helpful for CCHP in our outreach strategy and everything. So we took a very similar approach as everyone else, stayed connected internally, made sure that we had a work group comprised of, both product lines, so that everybody was in the know. And we had a really good outreach strategy planned. We actually did do some internal outreach, just with some mailers and things like that. That was just to try to get in front of consumers. We knew that they were going to get a ton of information from a lot of different places. So we wanted to make sure that they had information from us as well. And then we also actually partnered with a local vendor, Beyond Vision. So if you're not familiar with them, they have an amazing organization, mission, and vision for what they do over there, and they were great for this project. So they helped us with a lot of live outreach, and were able to connect with a lot of consumers who had transitioned off of Medicaid and helped them stay in our ACA product. Like others, we didn't probably see as what we thought we're going to transition over to our ACA product, but we had a lot of really meaningful connections with people, and for the majority, people were still remaining covered. So they were either staying in Medicaid, some transitioned over to employer coverage, or simply we just knew that they weren't a right fit for our marketplace coverage. So we leaned on some of our other relationships with people like our brokers or the navigators and assisters, and helped them get into other coverage on the marketplace. So overall, a really successful campaign for the Medicaid unwinding, and I think we'll just continue those tactics moving forward as things, change in the marketplace too. So thank you.
Thanks, Christine. Yeah, it was not challenging, but for MCAN and at a statewide level, I know just seen from the outside, if you will, trying to understand that real kind of churn rate, if you will, from Medicaid over to marketplace plans, and there just hasn't been the best data on that. But it's interesting and good to hear this from the individual plans too, that it maybe not the highest turnover to the marketplace plans. Let's continue that conversation on the marketplace. And our next question here is, again, kind of at a high level, but I'll just read it directly. What's your perspective of the current marketplace as we're moving into this open enrollment period? What are the high level trends you're looking at? What is the health plan participation that you're most engaged in? What effects do you think there are for consumers? What effects there are for yourselves and for providers? And how is your plan responding? I know that's like a quadruple barreled question, a lot in there, but please feel free to kind of respond to that. Your assessment of the current marketplace landscape, if you will, for this year. And Christine, if you're okay, I'll just reverse it around the horn again.
Yeah, absolutely. I think one of the things that we're really focused on is growth in that ICRA space. I know that was mentioned on the previous session. We're taking an approach of just trying to learn more about it, partner with agencies and ICRA vendors. We think that that's going to be pretty prevalent in the upcoming year, and we're going to see some enrollment growth in the marketplace. So we're just trying to really tap into that right now, understand how we can be a better partner to consumers, to employers, to agencies and whatnot in that space. So I think that's where we're focusing a lot of our time now, among other things, of course, but that's one of the larger ones.
Great. Martha? I think you're muted, Martha.
Hello. Okay. So we think that the IFP market really is fulfilling its goal of making sure that people who don't have coverage are able to find that affordable coverage. We've seen significant growth in the marketplace across the state of Wisconsin, and same with us over the past couple of years. And we really attribute that to two main things. The first is that redetermination process, just overall for the state, even though we didn't see a ton of that. And the second, we really think, is those increased subsidies through the American Rescue Plan. Those increased subsidies are just going to continue to be really important in maintaining and growing the marketplace going forward. And GHC really strongly supports the continuation of those subsidies. We're, actually working with our industry groups at the federal level to really encourage Congress's renewal of the enhanced subsidies. So even though, that isn't going to affect 2025, we really want to make sure that those subsidies are still there for 2026 and beyond for us.
Excellent. Jennifer?
I cannot echo that more. Those subsidies, with the potential of them leaving for 2026, it will be a big impact, and I don't think consumers quite understand that. So, anything that we can do as carriers and a voice for individuals who seek this coverage, I think it's really important. So, I cannot echo that more. ICRA as well. We have made the decision to exit the small group space, primarily because we have seen an increase in the ICRA space that we've seen. Individual plans much more affordable for more cities for. So I think it's something that we too have seen and are continuing to put more focus on our plan development for ICRA. Now, granted, a lot of that can also be off exchange, but it's just as important because the utilization is very similar.
Excellent hearing. Yeah, agreement on the subject. Doug?
I agree with everything that's already been said, right? We are seeing a lot of trends in the individual marketplace. Some of that is related to ICRA. I think we're in a really good spot in the state of Wisconsin as far as the number of available carriers, depending on service area and geography. So that's really good, right? There's options that are available for a lot of members that are seeking affordable health plans here in the state of Wisconsin. But much like others, we are monitoring what's going on from an ICRA space. Obviously, there's affordability issues that impact group. And one of the easiest things, not easy, I should never say that. Insurance is not easy. But one of the tools or levers that is being pulled is essentially taking an individual or a group plan and then putting individual HRA plans in place. We have seen an explosion of that in 2024. We think that's going to continue on in 2025. So for us, we are looking at what are the trends that are emerging, both not only from a local perspective, but from a national perspective. And one of the things that we continue to try to do from an organization perspective is something that we refer to as the catcher's mitt, right? Putting in place the ability to capture the membership either through individual, through Medicaid, or through Medicare, or other avenues that we have. For 2025, we will no longer be offering the Anthem Enhanced Choice, which was our short-term medical plan. There's restrictions on limited duration plans. So that's going to get some additional membership on there. I know that was part of your polling question. So for us, it's just making sure that we are offering affordable plans year over year, that we're providing the appropriate network and service provider panel for a lot of our members. And then again, just understanding what the movement is in the ICRA space.
Excellent, John.
A lot of apt observations, which I would agree with all of them, but just to maybe extend Doug's comments a little bit. Wisconsin has one of the most robust and competitive marketplaces in the country. In 2024, there were 14 carriers serving the individual market. So my perspective on the current marketplace is that it's diverse and competitive. And I think that the state has an interest in maintaining that competitive marketplace and has done so effectively to date in the history of the exchange in the state. I do think that we should be careful as an industry and healthcare stakeholders, and when working to keep Wisconsinites covered and with the best options possible about some trends in the market in terms of carriers and coverage. I think while 2024 and 2023 and 2024 were positive for a lot of carriers, most carriers, particularly those that had Medicaid products in their portfolio, potentially masking trends around consolidation of membership. I think that while all plans grew in 23 and 24 because of Medicaid unwinding, those that had Medicaid products, probably the bulk of those membership gains were by the plans with the biggest blocks of Medicaid, Badger Care Plus enrollment, right? And I think we just need to be careful about maybe what happens with trends on that. I think, we saw United enter the market last year. United's not on this call, but I suspect that we'll see them grow their service area footprint in 2025 and will capture additional market. I think the rate that we see growth in some carriers is outpacing others, probably the smaller community-based plans. So one thing I would want to do with this audience, with all the enrollment assisters and everybody that works in healthcare, is to not overlook the value that smaller and regional community-based health plans can provide, and especially the partnerships that we have with our provider partners. I think our market studies have shown that brand awareness, particularly for even a company like Quartz, but other smaller companies, significantly overshadowed by brand awareness of national companies. And so just want to keep that in mind, is to think of the availability of options through smaller carriers in the market.
John, those really insightful comments. And we know that, there's a lot of different dynamics in terms of how plans can market themselves, obviously based on different budgets and different reach. There was actually a question in the Q&A about this diversity, asking if there were other plans besides those on the call. And what you spoke to, 14, I think was the number. But yeah, there's a lot of other plans across the state. We try to just get a good diverse sample of folks from around the state and different scales of plans, and those people that would answer my email too. So that helps.
Hey, Justin.
Yep.
I just wanted to share, like, if people on the call aren't aware of carrier by county, there is an interactive map on the OCI that you can go to, and you can click on the map, and it'll tell you the carrier in that particular county, and it'll tell you if it's an HMO, POS, PPO plan. So there are some tools that are out there so that anyone can go and see that through the Department of Insurance. And that's a great way to say, okay, I'm in, let's say, Shawano County. How many different carriers are in that space? What options do I have for the members that I represent?
Super helpful, Doug. Thanks for sharing that. And maybe we can even get that in the chat. I know we have 7 minutes here. I really want to have this consumer question to the group, but I do have a poll question that I cues it up that I think's really helpful. So I think that's the second question, if we can launch that. And maybe Allison can read through it in our last few minutes here.
Yeah. So what do you think consumers find most important when choosing a health plan? Provider network is the first option. Low out-of-pocket cost. Low premium price. Additional benefits and value adds. Customer service. And then finally, recognizable brand/name. So folks are giving their responses. We'll give maybe about 20 more seconds. There's a lot to think through with there, and just thinking about what your consumers tend to, obviously every consumer is going to be different, but tend to find most important when choosing a health plan. So how about just 10 more seconds, and then I'll stop the poll and I can share the results.
And Allison, did they concurrently launch the other poll too?
It looks like it, yes.
Cool. So if you just maybe want to talk through both quickly.
Yeah. So the other one is, what is the main reason you think consumers drop or lapse in coverage? We have monthly premium payment cost, out-of-pocket expenses, non-utilization, don't see the value, missed payments and don't renew coverage, switch carriers, not happy with network or providers, and other. So let me end both. Well, end the first one, I'll share those results. So the most common answer was low premium price, followed by low out-of-pocket costs and provider network. So low premium price got about 42%. And then the other, we had biggest response, monthly premium payment costs. And then following that, out-of-pocket expenses, and then missed payments. A lot of payments, which is not surprising.
Thanks, Allison. Really helpful to have the audience's insight. And I think, like you said, maybe the trends from those responses are not surprising, but reaffirming. I'm going to pivot to our question around consumers here. I know we have 4 minutes. Hopefully we can go over just a minute or so, because this is a really important one around consumer education and just general experience. The broad question to the group is, what new techniques, or maybe not new, but approaches you're trying to use to improve consumer communication, especially maybe around health insurance literacy, and what are the most compelling cases for lower income populations, maybe to that cost answer to that last poll question, for lower income populations to select plans. Go back to John around the horn, and hopefully we can get it in here before the noon hour.
Well, I'll be really quick. I think we gained a lot of really valuable experience during Medicaid unwinding around how to take advantage of the flexibilities DHS provided and really do well in our ability to outreach and engage with members. We kind of took an omni-channel approach where we really pressed every avenue of communication we could. We did emails, newsletters, mail, outbound calls. We worked with provider sponsors to try to catch members while they were in the office, or to do outbound through their communication systems. We did text messaging, which was on the newer side in the way that we used it with our membership. We also used a third-party vendor that created a Medicaid unwinding app experience that provided information about the renewal process and where to go and get information about using the My Access app. And so we want to, and leveraging our community relationships and all of the touch points that we have with our community engagement and activities, and bring that health literacy and coverage option communications in those touch points we have within our community.
Thanks, John. Doug?
Yeah, so very similar, omni-channel marketing, right? Every channel that we have, as far as all the communications that is out there. We did something a little bit different this year as well. We did some positioning from a marketing perspective on things like pizza box tops. We did some coffee cup sleeves. We had some restaurant placemats where we put some positioning there. We even partnered with some Dollar Generals that on the back of the receipt, there was information related to Anthem to help folks navigate. And then this year we used social media like TikTok and Instagram, and used some social influencers to get people connected with how to learn more about a health plan. And I think that was helpful. And I think we'll continue to do that in 2025 as well.
Great. Jennifer, then Martha.
Listen to what our members have been asking us for the last couple years is they want to get back to being able to see us in person. So we're actually having monthly member meetings out in the communities that we have our members, where we spend an hour and we let them come in and ask us questions. They bring in their prescriptions. They ask how to save costs. So we're really getting out there, really face to face, really helping answers. And we found that has been really helpful, and our members really like that.
Yeah. So just like everyone else said, we've been just trying to use all of our channels. We've also been using a lot of health insurance literacy tools, just so that we can make sure all of our communications go through there, our website goes through there, so that our members can really understand what they're buying. And our website also right now translates to over 14 languages. So hopefully our non-English speakers can also gain more detail and information about that. And I think just trying to educate our members about what they should really be looking for in a health plan. One of the things that I think a lot of people need to think about is their annual liability, which is really their premium plus their maximum out of pocket, and really weigh that risk of what can I afford versus what could I potentially take on if the unthinkable happens. So really looking at both of those things when trying to choose a health plan, and also really taking the time to explain to them things like, when do I have to meet my deductible for the plan to start paying, or, is my prescription drug covered? And also taking a look at access as well. GHC is doing very well with access. Pretty much if you want to get in for something urgent, we can get in today or the next day. If it's something you want to get in quickly for like a week, and an annual physical is about a month. So asking those type of questions when you're really choosing that health plan, and spending time with our members, and encouraging them to call our member services so that they can get all those questions answered before they make their decision.
Excellent, Martha. Take us home, Christine.
Yeah, so like Jennifer mentioned, we've found a lot of success in just being local and being able to meet people where they're at. So we have
Oh no,
our.
I think she's frozen on my end. Maybe she'll come back to life. I know we are 2 minutes over, and we got through a lot today, and the QHP panel never fails to push us right up to the top of the hour. So I just want to say a big thank you to everyone, all representatives on the call here, John, Doug, Martha, Jennifer, Christine. Really helpful insights, and just helping us lay the understanding of what we've seen in the past year and even before, and what's coming up. Very helpful conversation. I know there were some really great questions in the Q&A. We're going to take those with us and try and answer them and respond back. These slides will be provided for all attendees. I just want to say a big thank you again to our panelists, and to Covering Wisconsin for hosting this conference. Hopefully I didn't keep you away from your virtual lunch for too long, and I'll hand it back to Allison to close this up if there's anything else.
Great. Thank you so much. And thank you, panelists. Really great information. And, we are always trying to, we can't have every QHP panelist on our stage every year. We try to experience as we can. And so also encourage, please, enrollment assisters to reach out to your QHP reps if you need more information. Yes, thank you all for being here today. I know I also mentioned that United Healthcare does have a virtual exhibit booth here today at 12 o'clock. You can pivot to that if you have specific questions that you wanted to address with them. And otherwise, we will see you all here tomorrow, 8:30 in the morning, having some great information and sessions again tomorrow. All right, thank you so much. Take care.